Hi, everyone. I'm Robert Nicholson, president of the ED Treatment Information Center, and today we're going to be talking to Dr. Paul Thompson. Paul is the Chief Medical Officer for Launch Medical, the company that makes the Phoenix home shockwave device. So, Paul, to start out with, what does the Chief Medical Officer do?
Oh, you wouldn't believe it. I'm getting busier. One, it's been involved in just looking at the causes of ED, not only it, down through history, but currently, and then looking at all the applications and the contributing factors, and then looking at the best treatment available. And that's really how Launch got started. Was we felt as though that the treatment was excellent. There was a relatively old treatment that had been used in the treatment of erectile dysfunction that we thought was fantastic. It was just prohibitively expensive. So as the medical director, it was my job to get involved and go through the literature. I had had a lot of use with Shockwave, both in erectile dysfunction, going back all the way to lithotripsy for kidney stones. So my job is to explain the technology and to be involved in that technology.
Yes, I've gotten many of the emails that you've been sending out, and those are really great. There's a lot of good information there. I'm going to encourage everybody to sign up for the Launch Medical emails, and I'll post a URL for that at the end of this session. But let's get a little bit into the science behind the Phoenix. So as I understand it, most men with ED, particularly older men, have issues with blood flow and circulation in the penis. And shockwave therapy addresses this in a couple of ways by breaking up the plaque that restricts blood flow and actually promoting the growth of new blood vessels. Is that correct?
That is correct. And when we talk about breaking up the plaque, I mean, I think we have this visual image that comes into our heads that we're doing it like we're treating a kidney stone. We're fragmenting it. And that's not really the way it works. If you look at the pathology of a penis after it's been shocked, you would find a huge increase in cells in the area. If you then measured some of the other things, you'd find cytokines, inflammatory cytokines, which we've all heard about now, COVID, but we have those inflammatory cytokines. And we also have a lot of growth factor that has come into the area, that's attracted into the area because of the micro trauma that's caused by the shockwave. So we do break up the plaque, but in the sense that we come in and we regrow the endothelium and actually can come in and grow new vessels in the area, secondary to all the growth factors, the stem cells. That's kind of the way the body heals itself. Interestingly enough, when this application for regrowth of blood vessels was first looked at, it was looked at in non-healing ulcers of the extremities in diabetics. And that's where it really started. And that's probably been, I bet you it's 20 years ago when we first started seeing that. And there's studies now with hearts and it's tremendous. But we've specifically, and our application that we're speaking about today is directed at the penis and the angiogenesis, growth of new blood vessels, and the repair of the vessels that are currently there.
So this healing process and the angiogenesis, this is something that takes some time. Would that affect the recommendations for the frequency of treatment? For example, older men who might take longer to heal, should they be allowing more time between treatments to allow that process to take place?
Well, we know that when you treat, you obviously are causing the micro trauma, and we refer to it as trauma. Obviously it is. There's some trauma there. We recommend, and we think in the studies and what we've looked at, the frequency that seems to work the best is no more than 2 treatments a week. Now, when we're talking about somebody older, it takes longer to heal. Okay, but you still need to create the stimulus for the healing. So the treatment frequency is many times exactly the same.
Okay, so no more than 2 times a week. If personally, I'm using a 4-day treatment cycle, and that's going to be just fine for most men, right?
Yeah, as guys, you got to remember. I mean, now I treat a lot with testosterone replacement, and I do a lot of wellness as for heart disease, etc. But my men, this is kind of like testosterone, and men are kind of like, hey, if one treatment's good, every day's got to be great. But
Right.
really, it's like going to the gym. If I go and work chest every day, it's not going to work, because where I'm getting the benefits is once I've caused that trauma in my chest, I go home and I heal. So that's why it's important to give it some time. You've got to draw in stem cells and all those different growth factors. And you've got to have that inflammation there. And then the healing occurs. And then you can go back and do it again.
Okay, yeah, that makes a lot of sense. Now, another thing that we see a lot of discussion of is venous leaks. Can you explain what that is?
Well, Venus leak, I mean, I can go in, you could write a book on venous leaks if you'd like. I wouldn't like to, but you could if you liked. Um, a venous leak is, you've got to be able to, it's easy, blood in, blood out. And many of those people will just come in and obviously they'll say, I get an erection, but I move or I do something and I lose it very quickly. Now, we have had some significant benefit using the Shockwave device around the base of the penis on the dorsal surface up top, and keeping it around the base. And we've seen some great results by doing that in the increase the integrity of those vessels. And they begin to work. Not only are you're increasing the blood flow in as well. So that's where the benefit comes in. Venous leak has long-term problem down through history, and as a practicing urologist, it was always frustrating. Some of those guys do well with some of the oral medications, but many do not. Many use a pump with a ring around the base, but we found that our treatments certainly do benefit those patients.
So the treatment protocol here would be different from the standard Phoenix treatment protocol. You're going to focus on the base, around the base of the penis, basically.
Correct. Each one of the protocols, and we have several protocols that we've done videos on and demonstrations. So we always want to be available to our patients. And you asked, what does the chief medical officer do? Well, I guess I'm involved in some of those recommendations and being available. But each one of our protocols is explained. Well, so maybe it's the Peyronie's, or maybe it's the venous leak, or maybe it's just traditional erectile dysfunction. Each one of those is explained in detail. And so, say for Peyronie's, we're going to take one of the passes away and focus that on the plaque. And that's, again, is available on our website, and you can pull those up and look at those specific protocols, and they're pretty detailed.
Yeah, I see that you guys are constantly updating the website and adding more information. So it's come a long way since the initial launch a few months ago.
We try and add, well, we had a little trouble coming out of the gate. I mean, COVID didn't do us any favors. We had a couple little minor hiccups, but we have my partners, John, Dustin, Stephanie, Austin are the best, and they're hard workers. I've flown out to California a couple times. I'm in Texas. Even during the COVID disaster, I jumped on a plane and flew out there a couple times just to shoot video or to talk or to go over things. But we've tried to add so much information, which is beneficial to our users, and what I refer to as my patients. But I guess I can't have them all as patients, but it's so beneficial. There's nothing worse than having a piece of equipment and not really being comfortable with how to use it. A tool that you don't know how to use is a worthless tool.
Yes.
And that's what we're talking about, worthless tools, I guess.
I wasn't going to go there.
I had to go there. You'll learn if we talk a lot. Well, you'll learn. I have to always go there. Sorry, you can edit that out.
There's a lot of discussion online, all sorts of things. One thing that men talk about is using daily Cialis as part of their treatment plan. Is there any benefit to that?
I think so. We first started seeing the benefits from that sort of treatment was where we first saw that it was beneficial to get that blood flow back going was on men after radical prostates. I've been doing a nerve sparing radical prostate. I don't do them anymore, but I was doing them going back to 88, 89, which was really early. But even those guys had problems afterwards, which you can understand. And what we did, we didn't have Cialis then, but we did later on. And that's when we added daily Cialis in at the 5 milligrams. And we also used a lot of pumps, the vacuum pump.
Yes.
And that combination, when you look at that combination with the use of our home device, we see a marked improvement over time. Those are the people that do the best. They really do. And so we believe that's really, I will tell you more than Cialis. I will tell you that absolutely the vacuum device is imperative in my belief.
I'm really glad you mentioned that. I know that a pump is available with the Phoenix and part of the standard treatment protocol. And I know that there are a lot of applications for the pump. For example, men who are going to get an implant, a lot of urologists and surgeons are now saying, use the pump for a month prior to your implant to improve blood flow and so forth. So that really is a critical part of sort of restoring the health of the penis, isn't it?
So it certainly is. And like I said, it's just the basic fact that you're increasing that blood flow and you're really opening up some of those vessels. And it's extremely beneficial to our patients. The results are much improved. They're already great, but you're going to make it even better, and you're going to improve the quality of erections, and it's going to be quicker. So you asked a question, and I want to go back and answer that. I don't know if you asked it or I just heard it, but we were talking a little bit when we started the time frame, and I think some people think that they can do a treatment and then run out on the town, and I personally scientifically know that's not how it works, although you can hard time convincing yourself once you do a treatment. It seems like it really works that way, but it really takes, I'll tell my patients, you're going to look to be optimal out at 6 weeks plus. That's when I really start seeing changes in people. But I like them doing the pump in the meantime. I like them on Cialis. And all that does is it's just giving us greater benefits.
Yeah, and I'm glad you said that, because I also see the same thing. I see somebody who's had one session and says, my God, it's so amazing. And that's great that they're experiencing it.
It's great.
That may play into maybe some psychological factors where it's just giving them a confidence boost. But bottom line, I hear what you're saying is this is a medical treatment. It's going to take some time, and people should be prepared for that and stick with the program. So
yeah, I'm adamant about that. I mean, I like that in practice. I like that 2 times a week for 2 weeks, and then once a week, and then give it some time. Because many times I have people go, hey, I think it could be better. I said, let's give it a little time, a little tincture of time. None of us, we're all impatient now. I mean, if our computer takes 2 seconds to load, we're irritated. But unfortunately, Well, fortunately or unfortunately, our bodies don't work. And it does. And if we're going to do this naturally, so it really works, so we don't have to take that pill all the time, so you don't have to use a pump, so you don't have to use an injection, well, let the body heal a little bit on it. And that's ideal. See where you're at. Many guys require more than 6 treatments. That's common. We know that. And some guys need on down at 6 months and 9 months. They might want to do 2 to 4, 6 treatments. That's the beauty of having your own device at home. You don't have to travel to a clinic. You don't have to take your pants off in front of the whole clinic and, do what some men consider the walk of shame through the office, that it's predominantly females. And, for what it's worth, it's humiliating. So the beauty is you have it at your home, you can do it. And we're there and we can answer enough questions. If any of the people that have them have those kind of problems, they can certainly contact us through our website, and we have somebody available to guide them and give them information.
Yeah, so you also have a very active Facebook group where a lot of these topics come up. Talking about the long-term treatment kind of segues into another topic. I've read some research saying that shockwave therapy is not really a permanent solution, that after a year or 2 years, the benefits taper off. I don't know if you're familiar with those studies, but I'm wondering if this leads to kind of recommendations for a maintenance plan using the Phoenix.
Definitely. And I kind of made mention of that, is that, sure, here's the problem. We have to look at vascular disease as a systemic problem. So we already know that if you have erectile dysfunction, you have a greater risk of having heart disease. We know that. Well, why is that? I mean, how is your penis and your heart connected? Well, it's a vascular tree. So we already know that if there's inflammatory markers, if your homocysteine's high, if your cholesterol's high, if your blood sugar's high, God forbid you're a smoker, not that I hate smokers, but you're not doing your vascular tree any favors, that you're going to have problems. Those same problems that caused your initial erectile dysfunction can certainly come back and do it again. So if you don't lower your blood sugar, you don't quit smoking, you don't get control of some of the things that cause problems, it's gonna reoccur. And in those people, we suggest, number one, they be evaluated, make sure their testosterone is good, make sure their inflammatory markers are low and their blood sugar is good and the cholesterol is under control. But we also would encourage those people to have a maintenance plan, which may be to repeat it at 6 months, 2 to 6 treatments. It may be a tune-up again at 8 months with 1 treatment, and again at 10 months. The home device is perfect for that, instead of going to the clinic again and spending another $500 for each treatment. Average right now about $500, which is not much less than the cost of the Phoenix.
Right. Well, Paul, this is great because you just segued into another topic, which is, older men, young men who don't want to have ED. What are your recommendations in terms of what should you be doing for your body and your health to reduce the chances of ED?
It's the same thing. If you looked at, I'm writing a book right now, and no one would believe I'm writing a book on being a vegetarian. I have made the transition. I've fallen off the wagon a couple of times, but if it is to reduce your consumption of red meat. Okay. Is the exercise really important? Exercise is one of the best things we can do to lower your simple carbs and sugars. I even talk to my patients, and my young patients. It's very common to see testosterone being suboptimal in my younger patients due to persistent organic pollutants and neuroendocrine disruptors and all those things that are another 2-hour discussion that no one wants to talk about. But we've seen lowering of testosterone, optimizing that testosterone because, not because it turns you into King Kong, because it regenerates your endothelium, which is the lining of your blood vessels, which is extremely important, and you don't want it inflamed. So if we begin to look at the easiest things to do for any man, not smoke, alcohol consumption moderately, socially moderately. Some people carry socially a lot farther than others, but let's say moderate alcohol consumption. Exercise, number one thing you can do for yourself. Then nutrition. I would cut back on my red meat. Most red-blooded Americans are not giving up red meat. And if you look at being a vegetarian across the world, I mean, it's one of my chapters in the book, it's really low. Even in India today, it's very, very low. It's not the majority. So, okay, we're going to have to watch our red meat consumption for multiple reasons. Try and eat fish, chicken, and eat more vegetables. Really decrease our simple carbs. Simple carbs are carbs that have been, oh, good Lord. Trying to get rid of that. Sorry, life of a doctor. I just make me sound important. You know, I have people call me during this, so I look important. But the simple carbs are carbs that have been already broken down. Like if you take wheat and grind it, that turns the wheat, a grain, from a complex carb to a simple carb. So that spikes your blood sugar. So we know that blood sugar is a problem. So decreasing sugars and simple carbs, those are easy things that everybody can do. And not only are they going to improve, they're going to improve their weight, which will, as you decrease your sugar, your weight comes down, your cholesterol comes down, your blood pressure comes down, boom. That's even for the young guys. So, I mean, those are really easy to understand, but for some reason, it's hard to implement. You know, it's easy for me to tell you, you know what to eat, what not to eat, but it's hard to push that cake and ice cream away sometimes.
You know, this is the things you're saying here. This is the advice that, you know, my doctor has been giving me since I was in my 20s. And, you know, you got to take care of your heart. You got to take care of your body. I wonder if they wouldn't get a better response if they said, hey, this is going to give you ED. You know,
I've tried it. You know, there's an interesting book out, and I've forgotten the author's name. I'm terrible. I feel sorry for him. It's called Change or Die. And basically the book is about kind of what you're saying. Scaring patients doesn't work. We've tried that as surgeons, as being a surgeon. You know, if you don't do this, you're going to get cancer. How many times you heard the doctor say that? You know, you could have cancer. And then somebody goes, whoa. But I want you to think about something. If I were a heart surgeon and I took a patient into the operating room and did a coronary artery bypass, yes, I'm improving the quality of his life, but I'm not improving the length of his life. Understand that. I'm not improving the length of his life. Why is that? That's because 90%, probably 90%, I'll say 90 because I'm trying to be nice. 90% go back to their old habits, which put them where they were anyway. So if you then look at that and you go, holy shit, excuse me, if having your, you know, now they're doing a little better, but having your chest popped open and your heart out and big wires in your chest, if that's not enough to scare the heck out of you, scare you straight, me saying, hey, you might get some ED ain't going to do it. But if you can educate and tell people why, sometimes they make better decisions. So kind of the thing that I've taken on in my practice, having moved from surgery into more wellness, is I try now to educate and tell them why. Some people don't care, but the majority of people, it's a little easier to say, this is why I'm doing this, is because Paul told me that causes this down the road. It's not Paul told me it's going to cause me to be impotent, because at a young age, most of those guys are supermen anyway. And they're just not going to do it. They're having too much fun. But I think if you really understand the reason, that you tend to make some of those modifications and do better.
Yeah, and it sinks in over time. Maybe the initial adjustment is small, but they start to change their lifestyle. And that's really what we need to be trying to do.
Yeah, if you really want, people always say, we ought to be preventative medicine. And the problem with that is you got to have patient participation. And sometimes that's hard. Sometimes that's hard. People have good intentions. I mean, every gym in the United States is packed January, February, and into March, and then it's empty again. People, they want to do well. It's just hard to stay focused. It's hard to stay on that diet. It's hard to quit smoking. It's hard to, those things are hard, but they're wise choices. And the reward is I'm going to stay healthier for a longer period of time with a functioning penis and heart, which seems important to me. But
that's great advice. I'm one of those guys that isn't going to give up red meat. In fact, I've got a couple of steaks thawing that I'm going to grill tonight, but I've cut way back, and
I'm jealous.
I've changed my diet, a lot more vegetables, a lot less meat, smaller portion sizes. So, it's a gradual process, but I think that anything we can do to improve our diets and get more exercise is going to help.
We're still going to, if everybody who got the Phoenix, which, as you know, comes with directions and comes with a pump and all the stuff, but if everyone just started modifying, begin to modify, because obviously they got there typically for a reason. And the typical American diet is the typical world diet is not that good. I mean, I quit saying American because it's pretty much, I just got back from Mexico and their diet's not so good either, but a lot of tortillas and stuff. But if we can do that and modify, we're going to get the benefit from using the Phoenix and getting that new vasculature and be able to maintain it for a longer period of time. Be more satisfied, not be on Cialis for long, have the pump as we need it, but you're not going to need the pump after your treatment until you treat again. Then you have it all there. I would suggest everyone use the pump while they're doing their treatments. But then in between, the majority of people aren't going to use a pump twice a day, 365 days a year. I'm guessing. I just don't see it happening. But you can focus to do it for 6 weeks.
Well, Paul, this has been great. You've answered a lot of questions, provided a lot of good information here, and I'm really encouraged to hear that Launch Medical and you are doing more to provide information and educate your patients, because it goes beyond just the device. So good luck with the Phoenix. Good luck with your efforts to change America's dietary habits. And thank you very much for being here today. And for the listeners out there, stay tuned. I'm going to post some useful links, and I really do encourage you to sign up for the mailing list from Launch Medical. There's some great stuff coming out.